The message here is that addiction is a disease. It's a chronic disease, that there are evidence-based treatments that are available, and that there are physician specialists that treat people with addiction, and that we need to grow the number of specialists out there in the workforce.
Dr. Kelly Clark is the president of the American Society of Addiction Medicine. She also treats addiction as a psychiatrist, and she believes medication-assisted treatment is the most successful option to fight the opioid epidemic.
We have decades of data on methadone, and we have decades of data on buprenorphine showing improvements in ongoing health and decreased risks of dying with these medications.
Dr. Clark says using this type of treatment also decreases the rate of HIV and hepatitis C cases. But she says people have to be willing to get treatment, and the stigma associated with addiction often prevents that. This is one reason why 12 states, including Kentucky, and 4 cities declared the week of April 23rd through the 29th National Addiction Treatment Week.
To understand that when people use chemicals, even if they were used as prescribed, it can change the brain. It can actually change the DNA of the brain. So it's not a matter of willpower or moral weakness. This is really a matter of changes to the brain. And the more people understand that this is a chronic disease, the more they educate themselves about this.
So what can we do to fight addiction? Dr. Clark recommends parents talking to their children about drugs early and often by teaching them how to deal with stress in healthy ways. She advises not to tell them drugs are bad because it often drives kids to actually use drugs. And clean out your medicine cabinet. Get rid of unused drugs. Now, if you would like more information on treatment options and other addiction issues, go to WLKY.com and click on the State of Addiction tab. Jennifer Bayless, WLKY News.